The first step, prepare the skin with the resurfacing cream. This cream can be applied before putting on the endomoware. Then we move on to the stimulation phase with the Cellular 6 Infinity. The first step is on the sacrum. On the device's screen, you can see the sacral triangle and the two lines along the iliac crests. Work very slowly here. This is quite a deep technique. You can add a slight pumping movement or work gently with a bit of resistance. It is very slow and it stimulates the entire parasympathetic nervous system, the reflex system. It is very important to begin in this area. If it helps, palpate the sacrum carefully, the triangle, and you can even draw the sacrum and the two iliac crests, because you really need to be very precise during this step of the treatment. This is the step that leads the way and allows the tissue to better respond. Next, we move up along the spine. It is important not to press directly onto the spine with the treatment head. Work very slowly. This also stimulates the nervous system. The endomoware tends to slip slightly around the neck, so with your hand, pull the endomoware up because you need to stimulate all the way up to the upper back. This is important because the parasympathetic nervous system is stimulated both at the pelvis and significantly at the upper back. So your hand can hold the endomoware in order to stimulate the upper back. Then we move on to these steps on both sides. As you can see on the device's screen, we work like this, parallel to the ribs, using a gliding movement. So always very intense, always very slow, and we will work the entire back in this way. Cover the entire back, go well down the sides toward the diaphragm, etc. The technique should feel generous and enveloping. On the upper back again, you can hold the endomoware to make sure you're working properly over the area. As you can see, we are already targeting fat release. While we are still stimulating the nervous system, we're also working on fat mobilization. The setting is deep, and if you feel areas with more volume or fat, don't hesitate to slow down even further. We are now on step 5, release fat and resculpt while firming. We start from the upper back, then move onto the arms and across the whole back. You can go down almost to the sacrum. Even if it's not shown fully on the screen, it's fine to extend the movement down to the sacrum. Start from the upper back with an enveloping motion, always slow. This is a very enjoyable step, so really take your time to do it, especially on areas where there is more volume. This will help enhance the results. For the arms, you can also place your hand underneath to get a better tissular grasping and mobilization. We move on to step 6 on the buttocks and legs, smooth and resculpt. These are the steps, and of course be careful, the rules are the same. Do not pass over the gluteal fold. This applies to all treatments. We move downwards and this helps resculpt. If during the assessment you notice that your model, client or patient had cellulite, feel free to add swing movements as shown in the video to target dimpling. Even though this treatment focuses on well-being and slimming, clients really appreciate the added smoothing effect on cellulite. So as soon as you see cellulite during the assessment, do not hesitate to add this swing movement during the treatment. Then we move into deeper fat release, this time on the saddlebags and the banana roll under the buttocks. We are not on the gluteal fold and we are working quite deeply. You can see this stimulation. Just through the movement of the device, the tissue is mobilized all the way down to the hypodermis. If there is cellulite, you can add swing movements. Once we have worked on the saddlebags and the banana roll under the buttocks, we use the same settings and the same maneuvers on the back of the thigh. So this can be done simply by working slowly with the device. If there is more volume, add a slight pumping movement. And if there are dimples, you can also add swing movements. We now move to the calf area. So remember that with the small slider, you can reduce the chamber size to get better adherence with the treatment head. We follow the movement shown on the screen, and this helps mobilize and decongest. It will be beneficial for the skin tissue. In a full body treatment, it is important to go all the way down to the calf when working. Even if there is no volume on the calf, it is important to treat the calves. On the opposite leg, we repeat the same thing. Saddlebags, banana roll under the buttocks, thigh and calf. Then, to finish this step, we drain, mobilize and decongest everything. This step starts at the middle of the back. We move over the buttocks, the saddlebags, the thighs and the calves. Be careful, as always, sorry to repeat myself, but do not pass over the gluteal fold. Move slowly. It is important to work down the entire leg from the upper back, avoiding the gluteal fold, all the way through to the calf to achieve a proper draining effect. There is work on the plexus, followed by a diamond-shaped technique across the whole transit area and the digestive system. Be careful, we do not pass over the center of the abdomen, known as the linea alba, and we always avoid it. It is important to understand that everything related to digestion, digestive discomfort, bloating, and inflammation is addressed during this treatment. This helps the client feel lighter with reduced digestive discomfort and a flatter feeling abdomen. Part of this effect is achieved during this step. Then, still on the abdomen, as you can see on the screen, we work in parallel lines to support fat release. You can add pumping movements where there is more volume, but not over the ribs, of course. We do not pass over the linea alba. Also, be careful around the iliac crest bones to avoid any discomfort. We now move down to the legs. We return to fat mobilization. Work well over the saddlebags and thighs. Do not worry about the inner thighs, as there is a dedicated inner thigh step afterwards. What is particularly important is to work thoroughly around the knee and its surrounding area. This is an area where there is often stagnation, fibrosis and adhesions, so it is very useful to mobilize around the knee. As with the calves, do not hesitate to shorten the treatment chamber and make it smaller. And if there is cellulite, feel free to add swing movements. We repeat the same thing on the opposite leg, fat release, focusing around the knee. We place the leg in a frog position so that we can work on the inner thigh. Always follow the same approach. Mobilize, release, and add light pumping. And then repeat the same thing on the opposite leg. We finish with this phase of mobilization, drainage, and decongestion phase. We work as we did on the back of the body, but this time over the front of the body to drain. We always avoid the linea alba.